Oxygen is absolutely essential for life. It is a colorless, tasteless, and odorless gas that plays a critical role in efficient cellular metabolism. Oxygen makes up 21% of atmospheric gas or room air. Medicated air is filtered air under pressure. It is cleaner and drier than general room air. Oxygen is not flammable, but supports combustion. It is considered a drug and must be ordered as such. The primary clinical indications for oxygen administration are to correct hypoxemia, which is a decrease in oxygen concentration in the blood and possible tissue hypoxia, which is an inadequate amount of oxygen at the cellular or tissue level. In this section, we will show all the existing oxygen devices. The brain needs oxygen approximately every 4 to 6 minutes. Other organs that are sensitive to oxygen levels and cannot survive without any extended period without oxygen are the heart, the lungs, and the liver. Technologists cannot prescribe oxygen. However, the technologist can change a patient's oxygen tank if it is almost empty, or provide a patient with oxygen therapy at the physician's request. When working with a patient on oxygen, do not kink, disconnect, or otherwise compromise any oxygen tubing. Also, the technologist should never remove a patient from oxygen without consulting a nurse or doctor. As a technologist, you have to know that oxygen devices may be continuous flow system or a conserving device system. Portable oxygen systems include a cylinder with a regulator consisting of a flow meter and pressure manometer. If oxygen is needed during an MRI procedure, it is important that the entire system be MRI compatible. This means that the entire system must be made of aluminum tanks or cylinders. It is important to check the portable oxygen system before transporting a patient to ensure that an adequate oxygen supply is available throughout the patient's transport period and duration of the radiographic procedure. The portable oxygen system must be secured during transport and should never be placed upright without support. The cylinder has two regulatory valves. One valve controls pressure and indicates how full the cylinder is, and the other valve indicates the rate of oxygen flow in liters. The pressure gauge indicates how much oxygen remains in the cylinder. At full capacity, an oxygen tank is pressurized to 2,000 pounds per square inch. When the gauge indicates a pressure of 500 pounds per square inch, 1/4 of the tank's capacity for oxygen remains. At a reading of 200 pounds per square inch, the tank is nearly empty. The flow meter is used to determine how much oxygen in liters per minute the patient will receive. The meter rate can range and vary from 1 to 15 liters per minute. There are two classifications of oxygen delivery systems. The low flow rate systems, in which the oxygen is mixed with room air, and high flow rate systems, which control the entire oxygen supply to the patient. High flow rate systems give a consistent oxygen concentration. They are run at sufficiently high flow rates or control the percentage of room air mixing with the oxygen supply to achieve a consistent oxygen concentration. The most common low flow rate delivery system is the nasal cannula or prongs. The patient inhales oxygen from the cannula as well as room air. It consists of two soft prongs attached to the oxygen supply tubing. The prongs are inserted into the patient's nares, and the tubing is secure to the patient's face. Oxygen flows from the cannula into the patient's nasopharynx, which acts as an anatomic reservoir. The fractional concentration of inspired oxygen varies with the patient's inspiratory flow. This system can deliver oxygen rates of 1 to 4 liters per minute, which is 24 to 36% of oxygen. Higher rates would dry out the mucosa. The advantage of nasal cannula is that it is easily tolerated by patients. The patient can eat, talk, and sleep without disruption. A major disadvantage is that regular use will result in drying mucosa or nose bleeding. Another low device is the simple face mask. Oxygen is delivered through a small bore tube connected to the base of the mask. Holes on each side of the mask provide an access for exhaled gases and serve to mix room air with the oxygen supply. The face mask can be used to deliver oxygen rates of 4 to 6 liters per minute, which is 35 to 60% oxygen concentration. Low flow devices require oxygen flow rates less than 5 liters per minute and are used for short-term oxygen therapy. The air entrapment mask is a high-flow oxygen delivery system. The system is able to monitor and control the amount of room air entering the patient's lungs. This entrampment of room air maintains a concentration close to 100% oxygen. To avoid mucosal drying, humidity can be added. The air entrainment masks are not well tolerated by patients. They are hot, stick to the skin, muffle speech, and must be removed for eating. The non-rebreather mask is also a high-flow delivery oxygen system. It is also called a partial rebreather mask. They have a bag attached that serves as an oxygen reservoir. It is capable of delivering close to 100% concentration when used correctly. The non-rebreather are not well tolerated by patients. It is hot, sticks to the skin, muffles the speech, and must be removed for eating. The aerosol mask can function as a high-flow device. It can be added on the air entrainment or non-rebreather mask to supply humidity. A sterile bottle of water or distilled water is attached to the mask via tubing to increase humidity of the oxygen entering and helps to prevent drying of respiratory mucosa when high concentrations of oxygen is required. The system can deliver 21 to 100% oxygen concentration. The Venturi mask can also function as a high-flow delivery system. The Venturi can be changed to modify the patient's oxygen intake as needed. Tents and Oxyhoods are used to deliver oxygen to pediatric patients. The oxygen tent covers the patient's bed, and the Oxyhood is a plastic box that fits over the baby's head. These systems can deliver 21 to 100% oxygen. Often, the oxygen source is connected to a large volume nebulizer, which provides humidification in the form of particulate water. Closed incubators are transparent enclosures that provide a warm environment for small infants with temperature instability. Supplemental oxygen can be added to incubators, but may result in a high oxygen concentration. The primary purpose of an incubator is to provide a temperature-controlled environment. The closed incubator can be used to deliver oxygen. The open incubator does not deliver oxygen. Ventilators supply oxygen through an artificial airway inserted into the trachea and connected by tubing to the equipment. The ventilator is used on patients who cannot breathe spontaneously or when their respiration is inadequate. They deliver a controlled respiratory rate with a preset respiratory volume. Imaging can be needed to confirm placement of the endotracheal tubing for patients on a ventilator. When imaging, care must be taken to watch for disconnecting tubing. Any malfunction can be life-threatening. The system allows a slack in the tubing to prevent condensed water flowing to the patient's lungs and potentially drowning them. Even flexing or extending the patient's head may adversely affect the placement of the airway and tubing. An alarm usually sounds if the patient's response changes or the machine malfunctions. The technologist should not silence or alter the ventilator alarm system without first seeking help or correcting the problem that caused the alarm. Continuous positive airway pressure, or CPAP, is a machine worn at night or during times of sleep to treat sleep apnea, a sleep disorder in which a person regularly stops breathing during sleep for 10 seconds or longer. A CPAP machine increases air pressure in the throat, keeping the tissues in the airway from collapsing when a person inhales. A CPAP machine delivers air through a mask that covers the nose and mouth. Other equipment, like the nasal continuous positive airway pressure, can deliver air through a mask that covers only the nose, or through prongs that fit inside the nose. The mask that only covers the nose is used more frequently. CPAP is the most widely used treatment for sleep apnea caused by blocked airflow in the throat or obstructive sleep apnea. However, the CPAP can also be used as a minimal invasive ventilation system. Instead of air, oxygen is delivered through the nose or mouth. However, the CPAP can also be used as a minimal invasive ventilator system. Instead of air, oxygen is delivered through the nose or mouth. In the nasal continuous positive airway pressure, or NCPAP, the mask only covers the nose. Air or oxygen is delivered through prongs that fit inside the nose. When imaging a patient on oxygen therapy, the oxygen device should never be completely removed from the patient for the purpose of taking a radiograph without the consent or supervision of a physician, respiratory care practitioner, or attending nurse. The devices can be repositioned if necessary to avoid artifacts on the image. After imaging, the technologist must ensure that any tubing leading to the device is not kinked or disconnected, and that the device is properly repositioned on the patient.
Thanks for watching. To purchase the full course and earn your CE credits, click on the link in the description or head on over to our website at www.medical-professionals.com. And while you're there, check out our All Access Pass, where you can get unlimited CE credits for your state and ARRT renewal for just $49.99. We also offer a host of free resources to make it easier than ever for radiologic technologists like you to achieve excellence. Check out our free Radiology CE webinars, clinical reference guides, and free CE courses on our website today. Be more than just certified. Choose medical professionals.